The Minister of Health, Dr. Joe Phaahla, officially launched the new HIV treatment adherence campaign out in the uThukela District of KwaZulu-Natal. Now, the campaign serves to communicate the scientific evidence that an HIV-positive individual who actually maintains an undetectable viral load is unlikely to transmit HIV sexually. Now, this latest campaign is part of the country's ongoing efforts to promote treatment adherence among people that are living with HIV in order to protect their loved ones from contracting the virus. However, the minister did stress that the campaign does not replace other prevention methods, including consistent as well as correct usage of condoms to prevent the transmission of HIV, STIs, as well as unplanned pregnancies. And to further unpack this, we have roped in Mr. Michael Mynhardt, the CEO as well as co-founder of MMH and Partners. Michael, great to have you with us. A very good afternoon to you. So let's talk about the impact of the new HIV treatment adherence campaign in the fight against HIV as well as AIDS here in South Africa. Do you foresee or project a significant as well as direct impact in the number of new infections in the country?
Yeah, it's always difficult to say because there's so many different factors that contribute to, the whole environment. And I think it's certainly a step in the right direction. Of course, it's focusing on education and spreading awareness of the details around the HIV virus. But I think it's also important to realize that without education, there's other things that are left hanging, but over and above education, there's so much more that needs to be done as well to really treat this holistically, as opposed to just in an isolated manner.
Look, Michael, I mean, in recent weeks, I'm sure you've seen some of the reports that were actually stating that alarming figures of youth were actually contracting HIV, even though there are these consistent campaigns. So what do you think still needs to be done to bolster awareness as well as ensure the correct usage as well as adherence to some of those medications, as well as, measures that one can take if you are affected by HIV as well as other STIs?
Yeah, I think there's three core principles over here. The first and the best way, of course, is prevention. If you're not able to prevent, then the next step would be detection, and post-detection, then you're looking at treatment. So it's always those three elements that you're looking at when it comes to HIV. And as I said, you always want to prevent, but if you don't, or if you're not successful in preventing, then you need to make sure that the country has the sophistication and capabilities to make sure that there's continuous detection happening to understand if individuals are positive and if they are infected, and if that's the case, to make sure they're able to get onto the regimes to treat themselves to make sure that they don't keep spreading the virus as well. So I think those need to be taken into account holistically when it comes to HIV. And of course, each one of them have their own challenges that we face and that we need to improve on.
Now, Michael, you've also called for improved access to quality, locally produced antiretrovirals or ARVs here in South Africa, which of course would guarantee then the security of these drugs. Tell us more about that.
Yeah, this for me is something that I think is extremely important. The last thing you want to do is have a situation where you regress all the progress that you've made, may it be through adherence to treatment regimes or may it be through education. If there are circumstances like the pandemic that we've just had, where supply chains are disrupted and you're not able to access the medicine continuously, then you're going to have a situation where a lot of the progress you've made to suppress the virus might be undone because you may not have the capacities to manufacture those products consistently locally. So it's really just to emphasize the fact that we need to make sure we always have the security of supply locally, so that if there's a pandemic, we're able to make sure that these individuals still have direct access to quality products consistently, and that their treatment regimes are not interrupted because of supply chains or sometimes things that are outside of our control.
And I mean, let's further extend on that. I mean, we always hear the notion, Michael, that it's issues of funding, particularly on research projects. That is the issue that government just cannot sustain. So what do you suggest can be done to bolster the research side so that we do have all these facilities operating right here in the country, so that we're not outsourcing from other countries?
I think it's a combination, and it just comes down to, the buy-in from key stakeholders. It's not always an issue of funding. Funding typically is available if it's local or if it's foreign. The key issue that we typically face is the offtakes and the demand side. What we see is we see international investors looking to invest in infrastructure and looking to push money towards building capacity locally, but they need to de-risk their investment by having some security of supplying these products either into the public and the private market. So ultimately what we're asking for is for additional preference to be given to local manufacturers on the demand side, so that if there are investments coming into the country to build new factories, that they're not left without supplying goods, and that they're actually able to supply into the state, supply into government hospitals, and ultimately to patients that need them most, but that the business is able to run sustainably with offtakes and with the demand side being taken care of by the government.
Thank you so much for that input. And I suppose consistent campaigning, Michael, would also, make a significant difference instead of, allocating certain months to create awareness. Thank you so much for your input there. Mr. Michael Mynhardt, the CEO of MMH and Partners Africa.